You're listening to Life, the Universe, and Everything Else. Today on the show, RFK Jr.'s fake causes of autism.
Life, the Universe, and Everything Else explores the intersection of science and society. Our music is produced by Ian James, and the show is edited by E.A. Moon.
My name is Jem Newman, and with me today I have Lauren Bailey.
Hello.
Ashlyn Noble.
Hello.
And Laura Creek-Newman.
Hi there.
As always, we will start with a disclaimer. More relevant today than on some other podcasts, but this is not medical advice. I'm not your doctor. Every person's situation is different, and you should speak to your own healthcare provider for any of your medical needs. However, we are a podcast that talks about the intersection of science and society, and that intersection has come to a head in the past month with a bunch of news related to autism and acetaminophen and other purported causes of neurocognitive conditions, which we would like to unpack as best we can on this podcast today.
Everybody get your suitcases out.
We're going to start off with Lauren, who's going to tell us what is autism exactly.
Well, it's me. It's a lot of the people at this table.
Their picture is in the dictionary under autism.
It's under a few things, but autism is the nicest one. Although I do not have a formal diagnosis because I do not have $3,000 to spend as a Canadian adult wondering if they are on the spectrum. But it is a spectrum. Autism spectrum disorder, also known as ASD, is technically a neurodevelopmental disorder characterized by, quote, deficits in social communication and the presence of restricted interest and repetitive behaviors.
May I unpack that a little bit for our listeners? So some advocates are now calling it autism spectrum condition rather than autism spectrum disorder. But when we talk about difficulty with reciprocal social communication, that means like difficulties recognizing and responding appropriately to both verbal and nonverbal communication in the way that other people can and do. And it is, as Lauren said, classified as a neurodevelopmental disorder or neurodevelopmental condition, which is like an umbrella category that also includes attention deficit hyperactivity disorder, ADHD. It includes intellectual disabilities and several other conditions. Now, some stigmatizing terminology will probably come up on this episode. That terminology is often in flux and is used in the literature, but it's important to remember that, like, brains are different. Every brain is different, and humans love to put things into categories, and
especially autistic humans. Yeah. We love that. I'm a big fan of sorting things.
But it's important to recognize, and we don't have the time or the expertise probably to go into a whole like disability studies curriculum here, but like any disability or condition, like the disability or condition exists in the context of the society surrounding it. So you can imagine somebody could hypothetically have 3 functional arms, and that would be cool. They could do more stuff, but it could also be considered a disability in our social context because none of the clothing would fit them properly. And people would look at them and they would say, why are you like that? Why are you different? So it could become a disability within that social context. So
but I don't have the ability to become president of the universe. 3 arms, Zaffa Beaverbrox.
Oh. He had 3 arms too?
Two heads, 3 arms. Yeah.
We're reading that part of the book, and I've missed the 3 arms part the entire time.
Well, he did have it grafted on. He wasn't born with it.
Picture some of those characters.
I only picture anything that was from the movie.
I honestly not a huge fan of the way the movie did the heads thing, but I think it kind of makes sense, and I do think that casting was pretty good. Like, I have a big soft spot for that movie.
Yeah. And for Sam Rockwell, we know.
Yes. Oh, no, I wouldn't say it's a soft spot.
Anyway, we digress.
Go away.
Go away. We could have just named this podcast Anyway, We Digress.
Yeah, we could have.
I don't know what else you want to say about autism spectrum. It goes from people who need a lot of help with their day-to-day to people like me. I didn't realize that I would be on the spectrum until I was after the age of 40. And it's probably because the DSM-5 came out in 2013, and that updated a lot of the diagnostic criteria and a lot of the things that we look for. I know, having done, they say they're not professional tests, but they are the same tests that psychologists and psychiatrists use. Looking at the tests online, I had always scored very high, but I didn't answer yes to every question, right? And Ashlyn's got other people in her life that are very much similar. They didn't
if I don't click every checkbox of all of the symptoms, that means I can't be autistic, right?
Yeah.
No, sweetie. That makes you extra autistic.
Yeah. And a lot of the diagnostic, it does have to do with the tester's biases.
Yeah, absolutely.
It is not something where you can look at the blood and say, yes, you have autism. You have this particular blood molecule that says you have autism. There is genetics that factor in. There's a bunch of other things that we're going to get into later. But what your parents have taken during conception or during your time in utero has nothing to do with it, as we'll learn later today. And that's about it. It runs the gamut. You could just be a little different than everybody else, or you can be a lot different. And it may be autism and it may not.
Yeah, and like as Lauren said, it's a spectrum, and for a long time, female children, there does appear to be a greater prevalence of autism among those assigned male at birth. However, much less so than was previously thought.
It's now about a 3-to-1 as opposed to a 4-to-1 for assigned male at birth versus assigned female at birth.
Mm-hmm. And you see kind of some similar patterns in ADHD diagnoses as well.
They're looking at girls. Who'd have thunk?
Yeah.
We don't just go into the, oh, you're too gifted classes.
Well, I mean, this was one of the lovely problems with so many of the classical diagnoses.
Mm-hmm.
Like anorexia used to be something that was impossible for someone assigned male at birth to get, because how could you have anorexia if you couldn't lose your period? That was a diagnostic.
Yep.
That was diagnostic. So you couldn't have it regardless of if you had every other symptom. So it's how, as we get better at these things and we start recognizing that, hey, maybe we've crafted this in such a way that we have selected who we think is going to have it, as opposed to actually saying, this is what we think is going on, who might have it.
That was part of this. I was never diagnosed with any sort of eating disorder because I continued to menstruate all through my teenagehood. And that was just a big thing in the 90s. It's like, okay, I guess you're fine.
And which parts of those, and a lot of DSM things too, like depending on which condition will be like, you must have at least 5 of these 9 or 12, right? Whereas others are like, you must meet all criteria. It really depends on each thing. Yeah. And I'm not an expert in it, but some are variable. And then if you have like, you must meet 5 of this, which ones are given the most weight, which ones are given the least weight, right? And
we will get into the sort of how the diagnostic criteria has changed between the 4 and 5, the DSMs. We'll get into that a little bit later. That's part of it. They've changed how they're looking at diagnoses. There's less, you have to hit all 5 of these. And so we'll get into that.
Okay.
But
so that's autism spectrum condition in a nutshell. Lots of folks have been preoccupied with the explosion of autism diagnoses that we've been seeing over the last several decades. And there are a lot of putative explanations for that. A lot of people are blaming various things, as we're seeing in the news right now. But before we turn to acetaminophen, let's talk about the classic putative cause, Let's talk about Andrew Wakefield, shall we, Ashlyn?
Hey! Why don't you not do that?
So, vaccines. If you ask a layperson, what are some things that you've heard might cause autism? Vaccines are probably going to come up. We've covered them many times on this podcast.
Several many. So
I decided that I would see how much my brain has retained over the years. Hi, Timmy. I have a kitten in my lap. I wanted to see how much my brain has retained from the many times that we have discussed this topic. So here we go. Nobody had much of a question about vaccines and their efficacy and their safety, especially as it has to do with autism, until there was one study with 12 participants that were recruited from a birthday party who were
Can we call it a case series, maybe?
Sure. It was a terrible, discredited study with a very small number of people. And Andrew Wakefield, human garbage, got the result that he wanted to get. It was biased research, and he claimed for many years that vaccines, specifically the MMR vaccine and the adjuvant thimerosal, were responsible for the onset of autism in these 12 children.
Yeah. And MMR is measles, mumps, and rubella,
right.
Which are, it's a vaccine that it's a triple shot. It protects against all three, and kids generally need 2 doses of that vaccine.
Trust me, you do not want to get rubella as a tiny baby.
No.
I was born before the MMR.
You got German measles?
I did.
Ooh.
It sucked.
You're still around to talk about it.
Yeah. I'm one of the lucky ones.
I was worried about a patient that I thought might have mumps, but they did not have mumps.
Good.
Still never seen a mumps case myself. We are seeing measles, though.
Oh, boy.
Good times.
All because of this dipshit.
Yes, all because of Andrew Wakefield, who, again, did a tiny, discredited study. So after his study was published, his case study, for many years, he gathered celebrities to his cause. People like Jenny McCarthy, ahead of the game in bringing vaccine hesitancy to the masses, in saying that, maybe we should just wait a while to give people vaccines.
Too many too soon. I'm pro-safe vaccines.
Yeah.
blame this
continued.
on Oprah.
Sorry?
I blame this all on Oprah.
Appropriate.
Oprah did not help, that's for sure. The study was eventually retracted. Andrew Wakefield eventually lost his medical license. This has not stopped people from continuing to cite this study as all of the evidence they need that vaccines are damaging children. And I would also like to take this opportunity to point out, of course, that an alive child is much better than a dead child, no matter what the side effects are. If it did in fact cause autism, bring it on.
I think we're all pretty
Vaccines would
great.
still be worth it, is what I'm trying to say.
And it's worth noting that Wakefield was in the process of developing and marketing his own single poke rather than triple poke vaccine.
He was going to benefit financially
this.
from this nonsense.
Yeah. So it was like, from a legal and scientific perspective, this research was fraud.
Fraud. That's the word I was looking for.
Not just like
to describe
not
it
bad
again?
Science, but actual fraud.
Yeah.
Yeah.
So the word that kept coming to my head was plagiarism, and that I know that wasn't what it was.
Yeah. On the right path, though.
Yeah, exactly.
Yeah.
It's been a long day.
That is a very concise, excellent summary. So the MMR vaccine is still in use. It is still part of our recommended vaccine schedule here in Manitoba.
Check your titers if you're an adult.
Mm-hmm.
And if you are missing your full vaccination series, you can get your titers checked. You can also just get updated vaccinations if you think you might be missing some. Sometimes hard to check out of province, but getting your actual titers checked can also be a big pain. Talk to your doctor if you're worried, especially now that we do have measles outbreaks throughout North America, but here in Manitoba, we've had several hundred cases. It is worth noting that the preservative thimerosal. I believe, Ashlyn, thimerosal was a preservative, not an adjuvant.
Oh, really?
If I recall correctly.
That makes sense.
An adjuvant is something that we add to a vaccine to actually cause a little bit of irritation to increase the immune response.
I have heard it's preservative too.
Yeah. So there are adjuvants in some of the vaccines. They make your arm hurt more after you get the vaccine.
Was that a different target of the anti-vaccine crowd? Was that it was adjuvants or something?
It could very well be.
Okay.
It's hard to keep track.
There are some people who have to not have that, I think. Right? Without adjuvants? Maybe never. I might be mistaken.
I'm not aware of that. There are some people who can't have certain vaccines that are live vaccines,
right.
so live attenuated vaccines.
More what I was thinking of. Sorry.
So some vaccines, there are different types of vaccines. Some of them use an inactivated or killed in quotation marks, because most people will say that viruses are not alive, but they'll use an inactivated virus. There are some that will use pieces of a virus. There are new MMR vaccines, and then there's live attenuated vaccines where they just contain a very small dose of a disabled but not destroyed virus. So, for example, the chickenpox vaccine, the varicella vaccine, is a live attenuated vaccine. So people who are immunocompromised, people who are pregnant, which is an immunocompromised state, people who are undergoing cancer therapy or have HIV, or there are a variety of conditions where people who've had a transplant, there are a variety of conditions where it would be recommended you not get live attenuated vaccines because while a healthy immune system can deal with it no problem, there's still a chance that you could actually catch the virus, the infection, from a live attenuated vaccine. The MMR vaccine, there is no chance because it is not a live vaccine. The flu, also not a live vaccine. You cannot catch the flu from getting the flu vaccine. You can feel some flu-like symptoms because a lot of the flu-like symptoms that you get are due to your immune system fighting off the flu, and you get like a mini immune response as part of getting the flu.
Or you could get it in the doctor's waiting room, waiting to get your vaccine.
That's another thing, yeah.
Without a mask.
That's very true. Yeah, you can go when you're waiting in line at the pharmacy or whatever to get your flu shot. You can catch the flu there.
Just through irony.
Yeah. So now we're going to get into the RFK of it all.
No.
I think, Lauren, you had mentioned that apparently RFK is a friend of Andrew Wakefield.
Or at least a colleague enough that it's
a fellow traveler.
Yeah, an unofficial advisor position kind of thing. They show up together.
I believe that I started my last segment about RFK with saying that Andrew Wakefield thought that he was like the greatest person for the job, which is all you need to know about him.
Yeah.
Jeez.
I remember something about this.
Mm-hmm. Yeah.
Any new listeners who want a refresher, we talked in detail about RFK Jr. on episode 208, the worst possible guy for the job, back in December.
God, was that December?
It was. Only December ago.
I mean, this whole term has been like a lifetime. So
I'm going to talk about Acetaminophen, or paracetamol, or Tylenol, to use.
If you want to get sued.
If you want to get sued. So acetaminophen is a compound. It's the active ingredient in Tylenol. Tylenol is an antipyretic and analgesic medication. So that means it reduces fever and it reduces pain. So acetaminophen, which is the generic compound that's found in Tylenol, also known as paracetamol in Europe, is an antipyretic and analgesic medication. So that means it reduces fever and it reduces pain. It is not the best at being a pain reliever. It's quite effective at reducing fever. It is moderately effective at reducing pain, depending on the type of pain. It is not very good for inflammatory type pain. You don't want to use an anti-inflammatory for that. Like
one of my favorite memes that I saw in the wake of this whole thing was chronic pain sufferers question whether Tylenol in fact does anything.
Yeah. So it is not an ideal medication. No medication is ideal. It is not addictive, which is nice. It has that over opioids. It doesn't cause any kidney or stomach gastrointestinal problems, so that it's better than the ibuprofens and naproxens of the world, the NSAIDs, on that score. However, it has a very narrow safe dosing window, after which it can cause severe liver damage. So it can be quite dangerous. And a lot of hepatologists will argue that it should not be available over the counter for that reason. An overdose on Tylenol, unless you get to your NAC protocol, use a medication called N-acetylcysteine to address a Tylenol overdose. Unless you're treated pretty quick, you can lose your liver. And human beings need a liver, it turns out.
At least most of one.
At least most of one, absolutely.
But it was also plentiful, like you said, over the counter and available when I needed it. So that's why I still stand by it.
And if you've got a tension type headache, or you've got some mild aches and pains, you have some arthritis, it's very useful. If you have a fever and you need to lower that fever to make yourself more comfortable, it's very helpful. It is also safe for continued use, provided you respect the dosing guidelines.
And the infant dosing is basically the only thing keeping some babies from going into febrile
seizures?
Yeah, febrile seizures when they have a fever, because they can spike so high so quick. So liquid Tylenol is a miracle.
It is also the only over-the-counter pain medication and fever medication that is considered safe for use in pregnant patients.
Whoa, hold up now.
However, in 2021, an international group of scientists and clinicians issued a consensus statement recommending that pregnant people avoid acetaminophen, quote, unless its use is medically indicated, end quote. I mean, I'd recommend you avoid any medication unless it is medically indicated.
Please explain to me a situation where people are like, I love taking my Tylenol for fun. That's what I do every day.
Don't take Benadryl unless you're having some sort of allergic reaction or you really need to sleep.
And the reason they issued the statement is they were citing a potential risk for neurodevelopmental disorders, including autism and ADHD in the offspring of those patients. In April of this year, incoming Secretary of Health and Human Services, Robert F. Kennedy Jr., announced that he would find the cause of autism by September. That is how science is done. It's done by deadline.
Science age logic. What a jerk!
Wait, it's the 30th today. Do we have that cause yet?
In early September, the Wall Street Journal reported that RFK Jr. was poised to, quote, announce that pregnant women's use of an over-the-counter pain medication is potentially linked to autism, end quote. And they pointed the finger in that report at Tylenol, saying that was the over-the-counter pain medication that he was going to announce. And on September 22nd, just 8 days ago, as we're recording this, the White House released a statement selectively highlighting the scientific literature and studies that found an association between acetaminophen use during pregnancy and autism. Quote, today, President Donald J. Trump joined administration officials to announce major progress in understanding the root causes of autism, which has exploded in diagnoses over the past 2 decades, and unveil bold new initiatives to tackle the autism epidemic. Predictably, the fake news immediately went into frenzied hyperventilation with their usual smears, distortions, and lies. Fact. Evidence suggests acetaminophen use in pregnant women, especially late in pregnancy, may cause long-term neurological effects in their children. End quote. Good news, I guess, for my trans male patients who are carrying children. Their children are apparently not affected by this.
Woo!
So, the question is, does antenatal exposure to acetaminophen increase the risk of autism?
No.
I doubt it.
So this is, okay, let's not belabor the point.
No.
So to speak. Boom, boom.
I'm awesome!
Let's not belabor the point. It does not. it's less implausible, I guess, than the vaccine question, and the evidence is a little bit more muddled, but quite clear when you look at it carefully. So,
if you have any modicum of scientific understanding.
Well, there are some scientists and physicians who are banging this drum, including the head of the T.H. Chan School of Public Health, I always want to say Andrea Bocelli. What is his name?
Yeah, that's an opera singer.
Chan.
Yeah. Would be amazing if was also the head of a school of public health.
Andrea Baccarelli. You can see why.
Very close.
Yeah, so that's the Harvard T.H. Chan School of Public Health. He's the dean there. He has been banging this drum and actually did an extremely poor quality review of the literature stating that Tylenol use, acetaminophen use, does cause neurodevelopmental disorders. However, many clinicians have pointed out that he has also been a paid expert witness in several trials in which patients claim that they have been harmed or their children have been harmed by acetaminophen during pregnancy. So there may be some bias there. In any event, to answer this question, I undertook a deep dive in the literature. And the study that I want to talk about in the most detail, because there's several very small, quite flawed studies that have looked at this question, because it's hard to study, right? You can't do a randomized controlled trial because for a variety of reasons. At this point, it's not considered ethical to do a randomized controlled trial. Somebody's in pain and you give them either an alternative drug or Tylenol or a placebo. We know the placebo doesn't work. So that would be unethical. You only use a placebo control when you don't have a well-established medical treatment, okay? So it'd be unethical to use a placebo control. It would also be unethical to use a different pain or fever medication because every other pain and fever medication, every other fever medication, and every other over-the-counter pain medication is contraindicated in pregnant women because we know that they cause issues. So you can't do a randomized controlled trial here. You could do case control studies, you can do cohort control studies and like that. So that's what we've done. The study that I'm going to talk about is the largest of its kind. It is also quite recent. It is acetaminophen use during pregnancy and children's risk of autism, ADHD, and intellectual disability, which was published just last year in the Journal of the American Medical Association, JAMA. And this is a very large retrospective cohort study done in Sweden. So retrospective meaning it was looking at past data rather than the study starts and you follow people forward. Prospective studies where you follow people forward are great too. However, they take a long time to do. Whereas retrospective studies are nice because you can look at data that has already been collected for some other purpose. You can analyze that data and you can get your answer pretty quickly. Okay. So it is also a cohort study. So a cohort study is where you look at a large group of people and then you see what the results of an intervention are, or you see what their risk of having a certain condition, giving a certain exposure is, which is what we're looking at in this case. Whereas a case control study would be you look at a bunch of people who got the outcome and then you look back at what exposures they might have had or what interventions they had had. So case control studies are very good for something that's very rare. Cohort studies generally are good for something that is a bit more common.
It is a broad spectrum.
Yeah. Anyway, this is a very large retrospective cohort study done in Sweden that was designed to examine the purported association between Tylenol use and neurodevelopmental disorders, including autism, ADHD, and intellectual disabilities. So it's particularly noteworthy, this study, both for its recency, it was just done last year, its sample size, which was 2.5 million children. That is a huge study.
That's nearly impossible to get that many people in a study.
It is more than 99%. The study sample size included more than 99% of the children born in Sweden between over a 25-year period, I think starting in 1995. And it's also notable for the fact that it did something that none of the previous studies had done, where it used sibling controls to tease out genetic and environmental confounding factors. Because one of the difficulties when you're not doing a randomized controlled trial, you're not controlling all of the variables, so it's really easy to get confounding factors. And we know there's a huge body of evidence showing that there are both genetic and environmental factors that affect the development of a lot of neurodevelopmental disorders. There's a lot of evidence for this for ADHD and has been for some time. There's evidence for this in autism as well. So, and environmental factors can mean like the physical environment of a child when they're young, but it can also mean the environment in utero. So what's going on with the parent who's pregnant before the child is born. Okay? Mm-hmm. So the great thing about having a sibling control is you can compare these kids to other kids who have the same or very similar environment. You study siblings that are raised in the same household, and the same or like extremely similar genetics. They have the same two parents, and they looked at same parent siblings rather than half siblings, what have you. So, in total of the population, or the sample size was 2.48 million children, and in total, 186,000, or about 7.5%, were exposed to acetaminophen during pregnancy, okay? And a very similar number ended up with a diagnosis of neurodevelopmental disorder. However, not the same 7.5.
I was going to say, pack it in, folks.
It's not a one-to-one overlap here.
No, not at all. Not even remotely. However, if you just look at a crude analysis, the absolute risk of a diagnosis of a neurodevelopmental disorder in those who were exposed to acetaminophen in utero was slightly higher in the group that was exposed to acetaminophen in utero compared to the group that was not. Okay? So, I mean, that's worrying, right? That's consistent with what the other studies were finding. So, those exposed to acetaminophen had a 1.5% rate of autism, compared to those who were not exposed only had a 1.3% rate of autism.
I was going to say, that sounded about 1.5 is the number that I keep running into.
So it's worth noting, even if this were true, which it's not, we'll get to, like even if this were like valid, that's not the cause of autism, which is what we were promised, right? You still
because we have all those other people who weren't exposed who still got autism. Yeah. So no, none of this can be the cause.
It would be like one of many potential risk factors, right? Similarly, for ADHD, the rate was 2.9% for those who were exposed to acetaminophen versus 2.5% for those who weren't. And for intellectual disability, it was higher. It was 0.8% versus 0.7%. Okay? So, seems like a slam dunk, right? We're seeing these correlations that we've seen in previous studies. But that is where the sibling control comes in. So, to address unobserved confounding, which is a major problem when you're not doing a randomized controlled trial, when you're just doing one of these cohort analyses, they used matched full sibling pairs. When they controlled for environment and genetics by using these sibling pairs, the association disappeared. And indeed, very slightly reversed, not to a statistically significant effect,
right?
But it did reverse. So once they did the sibling controls, they found that the hazard ratio, which is a different way of measuring.
Okay, hold on, everybody who's been saying we're going to take as much Tylenol as possible so you make sure that you get autistic kids. Let's make sure that we understand. Like, maybe let's take a step back if that association reversed. You don't want to be making yourself some normie children.
Yeah, don't open a model train store and then put Tylenol in the water
supply.
Yeah, right.
Saw that meme too.
Yeah.
I like trains.
Yeah, funny joke, but seriously, Tylenol is extremely dangerous if you overdose on it. Please don't.
Yeah, don't
give it to people like that. So the hazard ratio for Tylenol use and autism was 0.98, which means you're a little bit less likely because one is
just
parity.
Barely less.
Just barely. And the confidence intervals go to either side of 1, so not a slam dunk. ADHD similarly was 0.98 and intellectual disability was 1.01. So
that's like as close to 1 as you're ever going to get.
Yeah. So essentially
it's basically nothing. It's nothing.
Completely resolved.
That's amazing.
So this is like a profoundly good evidence that there is no causal link. Now, people will often bring up like the 8 or 9 criteria that you need to imply causation when you're looking at a public health perspective. One of those links is a consistent dose-response relationship. They also looked at that here, and they found no evidence of a dose-response relationship. For example, for autism, and I'm going to quote from the study here, for autism, compared with no use of acetaminophen, persons with low use, medium use, and high use, mean daily acetaminophen use, had hazard ratios of 0.85 for low use, 0.96 for moderate use, and 0.88 for high use, respectively. So you would expect a trend line, and you don't. You see a spike at moderate use, and you see lower levels at both low and high use, which doesn't make any sense if this is a causal factor here. Okay, much more likely to be random noise. The other thing that's great about this study is that rather than relying on after-the-fact patient recall, which is the way these studies are often done, where you see a parent with autism, with a child with autism, and you say, "Hey, did you take Tylenol during your pregnancy?" And they'll say, "Oh, now that you mention it, I think I did." Rather than relying on recall after the fact, antenatal exposure to acetaminophen was determined using data from prenatal appointments that were entered into the medical birth register. So we have something similar in Canada. In Manitoba, it's called the Manitoba Prenatal Record. And they also use data from the prescribed drug register. In Manitoba, we call it DPIN, for dosing. So the second data source was smaller because it didn't stretch back as far, and it also only included cases where Tylenol was prescribed rather than used over the counter. But the prenatal record, which spanned the entire data set, does include over the counter use because it's talking to patients at their prenatal. Hey, have you taken any medications, including acetaminophen over the counter? So you're not relying on this like after the fact biased recall. You're relying on contemporaneous data that you're accessing after the fact,
which is still needs to be filtered for memory.
Absolutely. But it is much more reliable. It is not unbiased,
not perfect,
but it is less prone to bias. It's about as good as we can get.
Yeah, unless we're keeping people in labs, please don't.
Interestingly, this data does show that even if you just use the raw data and ignore the sibling control, which would be a bad idea, even if you think that acetaminophen does increase a child's risk of neurodevelopmental disorders, other common medications, which we don't recommend in pregnancy, but which some patients take in pregnancy, including NSAIDs like Advil and Aleve, and anti-migraine medications, were associated with greater risks of neurodevelopmental disorders compared to Tylenol. Okay. But we already do, as I said, counsel patients not to take these during pregnancy for a variety of reasons, including the fact that it can potentially damage the developing kidneys or the developing heart and cause early closure of the ductus arteriosus. So the question now is, why did all of these studies seem to think that there was a link? It was pretty consistent in the data, right? Like, we had lots of studies that did show this very small but real, seemingly, association between Tylenol use and neurodevelopmental disorders like autism. Some of these scientists could be massaging the data because they had an ulterior motive. But often, much more often, we'd like to think this is because of like biases or confounding factors that we just weren't aware of, but that were controlled for with this sibling control.
Yeah. And all studies are flawed.
And this particular study had a really excellent discussion of the specific systematic issues with those prior studies. So they had multiple flaws and failed to account for 3 specific significant confounders that were effectively teased out by using sibling controls. So the first one is what we call confounding by indication. The second would be confounding by parental health and genetics. And the third is confounding by other medication use. And then they also discussed poor study quality as well. So confounding by indication is probably the biggest contributor and the most interesting from like a scientific perspective. So stick with me here. So
we've come this far, Jeff.
They said, I'll quote the study here. Confounding by indication may occur based on the reasons that acetaminophen was taken. For example, due to an infection, a fever, a migraine, or pain from an autoimmune disease. These indications for acetaminophen use may themselves be risk factors for neurodevelopmental disorders and may thus result in spurious associations. So it's not the Tylenol that's causing the autism. It's the fever, right?
The infection, the toxins, the whatever, right?
So I tried to come up with a non-medical or less medical example of this for folks who are less medically inclined. Let's say, for example, you're conducting a study on people with ACL tears, okay? Technically, it's still medical, but whatever. Stick with me. So in your study of people who've torn their ACLs, you discover that compared to the general population, a disproportionate number of people who've torn their ACLs have bought running shoes in the last 6 months.
Shoes guaranteed to make a kid run faster and jump higher.
Would it be appropriate then to conclude that running shoes cause ACL tears? Or would it be more appropriate to conclude that many of the people who you're seeing in your study with torn ACLs are likely to be more active than the general population, the reason that they might be buying running shoes, and that it's this activity that puts them at risk of ACL tears?
Unless you see a concurrence of, if they bought this brand of running shoe, this particular race thing, then they all tore their ACLs, then you should look at that shoe.
Absolutely.
Yeah, if you can tease that out, right? Yeah. But if you're just like, oh, all these ACL tears and people bought shoes, what?
Yeah.
So this assumption would be an example of confounding by indication. If you assume that these people are more likely to buy running shoes and they all tore their ACLs, therefore the shoes are causing the tears. Despite what RFK Jr. might suggest, it would not be ignoring the evidence to say, no, I don't recommend that you just wear your loafers onto the basketball court. You should actually get some runners. Other confounding factors that were mentioned are like parental health and genetics. So the study found that the people who were more likely to use acetaminophen during their pregnancy were also more likely to be of a lower socioeconomic status. We're more likely to smoke during pregnancy. We're more likely to have a psychiatric condition themselves. And we know that sometimes a lot of these are largely heritable, or to have other neurodevelopmental disorders. Okay. So lots of confounding factors that make the data messy that you need to control for.
I think it was an ologies segment on ADHD, which the doctor was talking about how it is strongly correlated that mothers who smoke during pregnancy will have children with ADHD, but also having ADHD itself is correlated with a higher incidence of smoking, because and ADHD is heritable, and so it's just sort of a whole chain reaction of
absolutely.
And when I listened to that, I was like, my mom's definitely smoked during pregnancy with me, and that is 100% the whole cycle that's going on there.
Yeah. So there's actually, I was chatting with a colleague about this a few months ago, and they brought up the idea that's been sort of tossed around in medical circles that part of the increase in ADHD diagnoses, like there's a lot of these things are multifactorial, as I'm sure Lauren will get into for autism, but part of it is lots of folks have been self-medicating with coffee and cigarettes. And specifically, nicotine is a stimulant medication. okay? It does lots of other things, but it's a stimulant medication, just like caffeine. So people have been self-medicating potentially. And now that you can't smoke indoors and there's more social stigma here against nicotine consumption.
That's metal in your lungs.
Fewer people are self-medicating with nicotine.
So coffee sales have gone up. Maybe there's a correlation.
In terms of confounding by other medications, acetaminophen use is associated with several other medications, including antibiotics, right? If you've got a bacterial infection, very important that it get treated. We'll treat the infection itself with antibiotics. We will often recommend treating a fever with an antipyretic like acetaminophen. And it's really important to avoid high fevers during pregnancy because that has neurocognitive sequelae. So...
Can we say that in English?
It has, yeah.
We got it from context.
I'm getting tired. I'm running out of steam. I'm falling back onto...
Sequelae.
Yeah.
I love how you explained everything else and then you end a sentence with sequelae.
Right.
He's an everyman, folks.
Man of the people, Jem Newman and his sequelae.
It has brain and thinking effects.
I love how it's either sequelae or not even a sentence.
Bad for brains.
Consequences?
Neurocognitive sequelae, brain and thinking effects.
Okay.
Sequelae means things that follow from.
Yes,
Yeah,
We all know we're just making fun of you.
All right, fine. I guess technically effect implies causation in a way that sequelae doesn't necessarily, whatever. Finally,
You said it, not me.
even if acetaminophen were associated with an increased risk for autism, for example, it would still probably be, again, this is not medical advice, consult your own healthcare professional. It would still probably be, in a lot of cases, appropriate to take it, especially if you have a high fever, because high fever during pregnancy is known to be a significant risk, as I said. And we also know that pain can have profound effects on both the parent and the fetus. Mm-hmm. So you don't want to be in agony all the time during your pregnancy either. We saw sort of a similar thing happen during the early portion of the COVID-19 pandemic when vaccines were first becoming available. So depending on your definition of early, there was a lot of preliminary evidence suggesting that the vaccine, or specifically one of the vaccines that was available, was associated with a rare but increased risk of myocarditis, especially in younger people. However, a lot of folks ignored the fact that what was associated with a much higher risk of myocarditis? COVID.
Yeah.
Getting COVID was a much higher risk of myocarditis than getting the vaccine. So you should still get the vaccine.
Choices.
This is trolley problem 101, folks. Both Health Canada and the Society of Obstetricians and Gynecologists of Canada maintain that acetaminophen is safe and effective in pregnancy when taken in appropriate doses for the appropriate indications. Please consult your doctor. And if you're pregnant and you have any new symptoms or a fever or any new concerns, talk to your doctor, okay? That's what we're there for.
But if it's 3 a.m. and you're spiking a fever and you want to take a Tylenol, you should be okay. That is not medical advice. I am in no way a medical human being. I have never said the word sequelae before tonight.
Talk to your doctor. But acetaminophen is, as I said, considered safe and effective in pregnancy. You don't require dose modifications for being pregnant, although if you have a liver condition, for sure, you should talk to your doctor before you take it.
But you will already know that.
Theoretically.
Yeah.
So we've talked a lot about the things that don't cause autism. Why don't we talk about something that doesn't cure autism? Maura?
Woo. Yeah.
Is your answer everything?
Yeah, probably. Yeah, like...
Gluten-free diet.
No, you know what? I didn't even do that. I only had so much time. When Jem and I were talking about what I might talk about, I thought, yeah, I'll go broad, gluten-free, casein-free diet, yada, yada, food dyes. And then, no.
We're just talking about the folic acid thing?
Yeah. So, because I think that one's more timely. Like, there's those perennial dietary and lifestyle modifications that people will claim cure autism that don't.
I'm a doctor with the cure. No, I'm not. I'm a general, and it's still a war.
And you just make everybody more miserable.
Yeah, I'll just park those there. Maybe I'll talk about them at some other point, but I don't feel like it tonight. So in any case, I am going to talk about Leucovorin or Leucovorin. I forget what the brand name is. Anyway, Leucovorin, whatever. This is...
Luchador.
What's that?
Luchador.
There you go. This is the RFK's answer to treating autism. So if Tylenol causes it, if you got it, you can just take this stuff and fix it. So what is Leucovorin to begin with? Well, as Ashlyn mentioned, it's essentially a derivative of, or it's part of the folate family. So folate is a vitamin. It always gets referenced as vitamin B9. No one uses B9. Like, no one who talks about vitamins calls it B9.
No,
like,
it's just folate.
It's just folate or folic acid. Like, we will sometimes distinguish between the forms because it has some importance. But anyway, this is just a little foible of mine. I'm like, nobody still uses, maybe in other places they do, but at least here, and like as someone who professionally worked with nutrition, nobody ever calls it vitamin B9, ever. But anyway.
I'm going to start now.
So Leucovorin is one of the brand names or pharmaceutical names for a form of folate, specifically folinic acid. So like I said, folate is a group of different but very similar compounds. Folate, or what we think of as folates, comes from a wide variety of foods, mainly plant foods, but some animal-based foods as well. If you're able to eat a wide variety of foods, particularly including leafy greens and legumes and some citrus vegetables, you're going to be doing pretty well in your folate intake.
Just eat some sunflower seeds. You're fine.
Yeah, like there's lots of things that are pretty simple for you to do. But that being said, historically, a lot of people did have deficiencies because they didn't have access to all of those things or to have access reliably.
Or to a wide variety of foods at all.
Exactly. Yeah. So there's a lot of, or adequate food, even if you had,
Your dietetics degree seems to like boil down to eat a wide variety of food. Like
I said to Jen, like I feel like such a bad dietitian because where I'm at today is, did you eat several times today? Cool. Great. Did you eat as wide a variety of foods as you can afford? And can we try to get you more of that? Okay, good. See ya. Great. Like, that's kind of what I feel like. Like, I'm being really glib with this, but that's kind of where I'm at.
And then autistic Lauren, who has lived on bread and cheese for the last week, walks into your office.
I have a lot of patience for that, but not right now.
Try increasing your variety.
So that's folate. Folic acid is something that a lot of people might be familiar with specifically. This is a synthetic form, so it's not a form of folate that occurs naturally in plants. That doesn't make it bad. It's just a little bit different. It has a much higher bioavailability, which means you can absorb it a lot better than folates that are in food. Mm-hmm. And it's what we use to fortify food. So in Canada, we have mandatory folic acid fortification programs in our white flour.
Folate and iodine. It's so weird.
But those are different. They're in different foods.
Yeah, I know. It's just so weird that they're...
So they did that. So we have mandatory fortification. So all of our white flour in Canada standard white flour is fortified with folic acid. And then, so folinic acid is just another one of these very similar compounds. Basically, the difference is once it enters your body, some of these compounds are basically good to go and they can have their metabolic effect. Most of them need at least some metabolism, having a bit of their chemical structure added on or taken off. But they all end up in the same place and do the same thing. Folinic acid is a little bit special in this category because unlike most of the other folates and folic acid, it doesn't need a particular enzyme to do the last change that makes it bioavailable to do what it needs to do in the human body. So some people have trouble with that enzyme, be it for genetic reasons or other health reasons or whatnot. And so it can be a way to get you the folic acid or the folate that you need if that enzyme step isn't working for you, like for whatever reason. So it is a little bit special in that way, and it has good uses. So folinic acid has been around for a long time, decades now. Typically, it's actually not used as a folate supplement. It's not used in your prenatals. It's not used in your multivitamins. You're not going to find it on the shelf on the vitamin shelf at Shoppers. Yeah. And that's because it doesn't, for anybody who just needs more folic acid in their diet, like pregnant people, folic acid does the job for almost everybody, like absolutely almost everybody. So you're not going to see it there. But it has been used pharmaceutically, particularly alongside different chemotherapy regimens. So there's a really well-known chemotherapy med called methotrexate. One of the things that it does is it shuts down the folate pathway. So it stops the folate action. And that's part of what stops cancer cells from multiplying and functioning. So when you take that medication, you take the methotrexate and it stops the folic acid, it kills some of the cancer cells, and then you take this folinic acid after to help rescue those cells. And because of its different pathway, it helps like the body cells actually get the folate so the whole body doesn't die, but the cancer cells will still cure. Okay, so it's like a balancing act.
That makes a lot more sense than how I heard it that it would strip the folic acid from your cells.
Yeah,
that didn't make sense. Your way makes sense to me.
I'm not an expert in this, but this is kind of what it does. And then in different types of chemotherapy, folinic acid actually increases the effectiveness of that type of chemotherapy. Neat. Yeah, there's something about the type of cancer and the type of medication that having the folinic acid makes it more effective in treating that. So it's largely taken in the context of those situations, or sometimes some people will take something like methotrexate for non-cancer reasons, or sometimes you might take an overdose by accident or whatever. It can be helpful. It can be used then in rescuing after that.
I don't know why I decided to dive down this rabbit hole, but I went to look at what other things is mandatory to have folic acid in, and I found a whole table from the government, so that's cool. 2 of the other things that is mandatory to have folic acid in is any simulated meat products.
Oh, yeah,
or any products that are purporting to be or simulating a whole egg.
Yeah. Okay. That makes sense.
So it makes sense.
But that's not for fortification reasons. That's because to claim that you are nutritionally similar enough to call you like a meat analog or an egg analog, you have to have a similar chemical makeup.
Gotcha.
So field roast, which makes a very good veggie sausage, in my opinion, they couldn't market in Canada for a long time because they weren't adding the right amount of these B vitamins to be comparable to a meat-based sausage. So that's they're all fortified, but they're for different reasons. Yeah. Okay. I gotta get this show on the road here. Sorry about all that. So anyway, folinic acid is a real thing. It has real uses and has continued to have real uses for many, many years to today. Okay.
It has its niche. We know where it is.
Yeah. So where do we get this autism connection with this? Well, we have to look at what folate does. Why do we even need folates in our bodies? It's a vitamin. That means that we need it. We can't make it ourselves. We need it to live properly. That's the definition of like a vitamin. Okay. So folate is used in a lot of metabolic processes, particularly in DNA synthesis, and also in nerve cell development and repair, and in red blood cell development as well. So if we don't have enough folate, we have problems with all of these things. And so with DNA synthesis, anytime you have a tissue that has cells that regenerate a lot, that's going to need a lot of DNA. So if you don't have enough folate, you're going to have problems, if you can think of it that way. Okay. So one of the best known things when we think of folate, and the reason why we have mandatory fortification in Canada, is because of something called neural tube defects. So this is known as spina bifida is one of the best known ones, but it can be things like anencephaly. That's where whole brains don't develop in utero, which is the most severe presentation. All sorts of things like that. So when Canada implemented required fortification with folic acid, neural tube defect rates dropped dramatically because there was more of it in the supply there. So it's one of the great public health interventions that we've done here in this country. So there's also potentially some evidence that low maternal folate levels, if the mom isn't, or if the pregnant person rather, isn't getting enough folate or doesn't have enough folate source or can't metabolize it well enough, then the fetus, which has rapidly multiplying cells and has huge DNA demands, isn't going to get enough, and that's where they're going to have these problems. Does that make sense?
Yeah.
There? So there's a potential connection as well with other neurodevelopmental conditions, because if you think this is well known to affect the nervous system, it does kind of flow that it could affect other neurodevelopmental conditions. So there's some evidence that looks at the rates of people who had low folate intakes or low folate status during pregnancy and the autism rates in their children. And there's some evidence that says that there's higher autism rates too. Now, at least of the studies that were mentioned on the NIH folate fact page for health professionals, a lot of the studies that were referenced were coming out of countries that don't have mandatory fortification. So that is interesting that you would talk about that. Not because it's not relevant, because in those countries it is relevant, but it also just kind of talks about how, like, it's going to be different in places like the US, which also has mandatory fortification.
For now.
Thank you.
But only for now. For now. Only for now. For now.
I think that's an important distinction to look at there, because we've known for decades that fortification decreases these kinds of rates. And so it's interesting to look at these kinds of things. In any case, that's a bit of a digression. But why I say that is because there is this question about other neurodevelopmental conditions, including autism, going along with folate status. We can see how there could be potential connection. I'm not saying yes or no. I am not an expert. I'm saying this kind of tracks, right? Okay, so how did we get to Leucovorin treats people who are already born and living with autism, right? Because it's a very different thing to say a person who is pregnant should have enough folate during their pregnancy to help prevent neurocognitive issues or whatever or developmental issues. It's very different to have a person sitting in front of you being like, here's some folate, take that and your autism is going to go away. These are not the same thing at all. They're entirely different, in fact. So this comes from this connection of autism with something called cerebral folate deficiency. Is anybody familiar with that or heard about this? So very shortly, this is a real condition that basically what happens is that even when the rest of the body has enough folate and you have enough folate stores, the brain doesn't. And there are some congenital genetic mutations that cause this, and it can lead to seizures and developmental delay and a lot of really tough things because people genetically, their receptors for folate in their brains are not working properly. That is incredibly rare. It's like 1 in a million prevalence or something like that. So it is very not rare. There's also some thought that this can be acquired through autoimmune processes or through other syndromes. So you can be born with with your brain using folate properly, and then your body destroys it. Just like in type 1 diabetes, your body just starts to destroy its own islet cells, so you don't make insulin anymore.
Rude.
So that's where this thing is. So this is a real thing that does happen.
Rarely.
There's been the genetic one is very, very rare. The autoimmune one is still quite rare. It is still quite rare. You're not wrong. Where this comes together is that some studies have looked and said, well, people with autism or autism spectrum disorder have more of these autoimmune antibodies and potentially fewer of these folate receptors in the brain compared to people who don't have autism, and from what my cursory look at the evidence and looking at different experts is that while this may be true, it's not a silver bullet, much like Jem was talking about with the Tylenol and the siblings studies. Some people have said, oh, well, they have this lower level, so that means they're not getting enough folate, so we just need to pound them with this folate, right? But other evidence has said, well, genetically, the whole family might have these low levels or high antibodies, but not everybody in the family has autism.
Yet.
But that's important, right?
Yeah.
Because if it was a one-to-one cause or like something like that, like, oh, it's all because we can't say, there's no evidence to say, and even that all people with autism have this like autoimmune anti-folate, therefore we can give everybody this. If it is that many, it's a smaller subset of people with autism. So this isn't even going to treat everybody, even if this is truly a treatment for it.
Right.
The studies that exist, as with a lot of these things, there's a couple of researchers that are really like on this bandwagon. And so when you look up the studies, it's the same couple of names over and over and over again coming out of the same institute. This does happen in legitimate research, but it's something you got to watch for because you also want that replication, right? You want independent people to find the same things or to look at the same things.
Yeah.
Because that helps us not be in our tunnel vision and not make mistakes that we might be making. I am not saying anyone's making mistakes. I am saying it's nice when you can see, oh, this other group did this too. Right? Or to see similar results with the same protocols and that. And we don't, everything is small right now. I have a bit of a concern because one of the big names who pushes this Leucovorin is like, I stopped dealing with the regular system because it was too slow and I do my own thing now. I'm like, red flags! Always red flags.
Yeah. And also the fact that Dr. Oz has got a huge...
In Leucovorin?
In Leucovorin.
Mm-hmm.
Like,
it's a literal grift.
Yeah. That
not breaking news here. But...
Anything Dr. Oz touches is a grift. So some people may actually benefit from this treatment. To say it is a treatment for autism and just throw it out there as a blanket statement and like Dr. Oz did promise it to everyone has absolutely no basis.
Yeah.
So it's not going to hurt you to eat a wide variety of foods that have folate in them. If you really think that you need more, a lot of the folic acid supplements are very safe, especially if you take them in the lower doses. Some people might need higher doses if they have genetic conditions or predispositions to things. You should talk about that with your care providers and do that carefully. As for Leucovorin, probably you only want like your oncologist or some kind of specialist prescribing that, and you should not be going to get it yourself.
Don't self-prescribe that one.
No.
Self-prescribed sunflower seeds.
There you go.
Tasty and fun to spit at people who give you Leucovorin.
So now that we've covered lots of fake stuff, Lauren, what's the actual story with autism?
I don't know. No one knows.
I like trains.
That's kind of a downer way to end a podcast.
Okay, there are some ideas, but you can't point to things like low folate levels and say that's what causes autism. You can't point to trains and say that's what causes autism. That's a symptom, not a cause.
Not a cause.
It was the train shop that started him off.
Yes, it's the HO scale that really gets you. There's been studies on autistic people who, they show that there are differences. But the differences are also different between autistic people. Some people will show things that are, there's definitely brain stuff, obviously, with everybody, but also like gut stuff. A lot of autistic people also have like a Crohn's or something. It's not a one-to-one comparison because it affects everybody differently. There's limbic system abnormalities, frontal and temporal lobe alterations, and basically it just affects your whole body. We're not quite sure what causes it. The leading indicator is genetic. I saw a meme the other day, and we can beep this if we need to, Nora, but the cause of autism is autistic people fucking. Yeah. But there has been, between the DSM-4 and DSM-5, there has been a change in the diagnostic criteria. And that was from 2013, and that's where we've seen sort of the, I don't want to say explosion of neuroatypicality, but this is what the people on the opposite side from us are going to call it, is an explosion, because people are now being diagnosed earlier, later, and in more numbers. Because we know better now. Mm-hmm. Like before we were talking about, it was probably 4-1 from children assigned as boys versus children assigned as girls, that kind of thing. But it's not. It's much more close. Like I said, I haven't been diagnosed, but it wasn't even on my radar until I was in my 40s that this might be autism. Mm-hmm. And it's the thing going around our house a lot is, how did nobody know? Like, this is pretty obvious. If I've got the diagnostic criteria changes between 4 and 5 right in front of me. They changed where it was located in the manual. So it is no longer a disorder first diagnosed in infancy, childhood, or adolescence. It is in a section called neurodevelopmental disorder. Mm-hmm. So it's not hidden away in, here's a baby disease. So you can diagnose it at any time. Mm-hmm. There used to be 3 subcriteria, and now there are 2. And it just talks about persistent deficits in social communication and interaction across multiple contexts. It's not Billy doesn't talk or Sally doesn't make eye contact. We're looking at it more as a whole, of how they're communicating and keeping up developmentally. And there's also where there used to be qualitative impairments in communication and restrictive, repetitive, stereotype patterns of behavior. Now it's gone from stereotyped to restricted, repetitive patterns of behavior, interests, or activities. So we're seeing that is a wider range of not saying this kid only likes trains. It's now saying this kid, maybe instead of shooting marbles, stacks all their marbles in an upside down kitchen stool where they put all the marbles together for hours at a time, like I used to do for hours at a time on the weekends when I was a child. I think I've talked about that before. Where we used to need 3 out of 3 diagnostic criteria. Mm-hmm. Now it's 2 out of 2, and they're much broader criteria. So we talked about the persistent deficit in social communication and deficits in nonverbal communications. So your verbal and nonverbal don't match up all the time. Mm-hmm. So that is a much wider diagnosis than this kid can't talk or this kid doesn't understand language. It's this kid's vocal and non-vocal communications don't always match up. Mm-hmm. It's not just the can't look me in the eye. It's sometimes we'll look in the eye, sometimes won't. That kind of, you have to look for the patterns. Mm-hmm. So it's hard to diagnose. Mm-hmm. You can get it as, like, a parent will most likely know their child best. Especially if they're keeping up with things and paying a lot of attention to the literature and whatever. You can see as early as 6 months, but then you get people who have been socialized as girls. A lot of childhood feminine behavior is meant to mask things, like autism spectrum. Mm-hmm. Because I'm taught to look into
meant to mask things, or like they're socialized to mask things like that.
Socialized to mask things, and also the behaviors are excellent masks in and of themselves.
Sounds very gender essentialist of you.
Okay, well, it's not like what people are showing, it's what people are taught to show.
That's what I'm saying. I feel like you were saying feminine behaviors mask autism.
No.
Yeah.
I understood what they were getting at.
I appreciate the delineation. It's people who have been taught the stereotypical feminized behaviors. It can be more of a mask for something like autism.
Right. Mm-hmm. And the people who are teaching them those things aren't necessarily meaning for them to mask things, but those behaviors as girls are socialized, the way girls are socialized to behave traditionally, it does serve to mask a lot of their inner workings.
I was pretty sure that's what you were getting at, but I just didn't think it was coming out right.
No, I appreciate that, because my communication isn't great. I'm just going down the list, and there are half of the diagnostic criteria. Like it's half as rigid as it used to be.
Yeah.
So that's why we're seeing
you're going to have so much more. And if you have a lot more,
it's known.
It's known, and you have the interpretive flexibility. Whereas before, whenever you have a very rigid set, like must love trains, in your diagnostic criteria, you'd be like, it's easy to be like, well, this kid likes trains, but do they love trains? Maybe I won't put it because I'm not sure that they love trains that much, right? So you have there's that whole group that was, and now it might be like, oh, you like trains, eh? And you go. No, I don't mean it that way. I just mean like you can be so much more flexible and fluid with it rather than over restricting.
I do want to mention that autism spectrum occurs in all racial, ethnic, socioeconomic. It is more likely to be diagnosed in higher economic white boys. But it's, again, it hits all factors pretty evenly.
Right.
Whereas you see oppositional defiant disorder or specific learning disabilities or intellectual disabilities diagnosed more often in children of color, for sure. My understanding is that psychological professionals and pediatricians are trying to be more aware of their biases there as well.
We'll see. But what got me thinking about it is a friend directed me to an article about, I'd been diagnosed sort of with BPD, with BPD tendencies. And there was an article, she's a bitch.
Cluster B traits.
Yes, cluster B traits, that's it.
Right.
No, you only say that about teens when you can't officially diagnose them.
Yeah. And that's what they're seeing a lot of these people with these cluster B personalities, these BPDs or whatever. They're finding that a lot of it correlates to like an autism diagnosis.
That's interesting. I mean, certainly I'm not a psychiatrist. The things that I would be on the lookout for BPD or cluster B would be like, I feel like fairly different things that might ping on my radar for autism spectrum. But yeah, okay. I may just be changing patterns.
Well, I think it depends.
Too.
And BPD is a really good example of one of the ones that it's like 5 of 9 criteria. Yeah. So which 5 you got versus which 5 I got, our presentations and lives probably look very different versus which 5 they got and which 5 they got. So that is one that is one to be... Yeah, that one's just a tricky one to begin with. But Jen, what I'm thinking of, like
the ones that I'm on the lookout
anxieties
for
of like people are going to leave, people aren't around me, nobody understands me, I don't know who I am, how do I fit in?
I need to mask differently in different situations.
Like this,
absolutely.
Those parts of the BPD align, like could be, right? Yeah. Like, but maybe not the explosive emotions, perhaps. Like, for some people, but maybe not, right?
For me,
some
it was the explosive emotions.
Yeah.
Because I sit on everything. And they...
difficulties with distress tolerance or rigid patterns of thinking can definitely,
And, like, going back and talking to my parents, my mom always said that I was a child who needed my alone time. And who would just occasionally have a tantrum for no reason and just melt down. Sounds pretty familiar, but it wasn't diagnostic back then. I know I'm kind of getting into lore is not data. We are expanding the diagnostic criteria. People are looking at their children and their patients better, and their children are getting diagnosed and they're going, hey, that sounds like me. Maybe I should take a look at this. So we're getting a lot of retroactive like that too.
Yeah, I think a lot recently about how there's those like, oh, the autism came out of nowhere in this family. And you're like, are you sure?
Yeah.
Grandma,
can we just back that up?
Grandma, don't you have an entire cupboard full of plates that we're not allowed to use that must be stacked perfectly?
Yeah. Or that meme from Futurama. It's like, here's my drawer of different lengths of wire arranged perfectly. No one touches them. Like,
It's not a leap of faith. It's high-functioning autism.
I think I've mentioned it before on the podcast, but my mom had the perfect classic reaction when I sent her an article that was, here is how ADHD may present in female people. She read it and got back to me eventually and said, Ashlyn, everybody feels this way. Like, you're being
close.
Dramatic. Like,
you're
okay, Mom, sure.
Well, maybe you and I do, but that doesn't mean we all do.
Means, Mom.
And then we throw in the world of trauma experiences and how that changes a brain and all of these kinds of things. So
I don't want my kid to have a label.
Yeah, there's a lot of it. But
to be fair, I'm not blaming my parents for not having me diagnosed in the 80s. That's not
Yeah.
That is not on them at all. That is not something that would have happened.
Yeah.
So.
Perfect. Thanks, Lauren. That's good to think about.
Does anybody have something nice they want to tell us about?
We just returned from a wonderful long weekend in Riding Mountain. It was my first time going to Riding Mountain. We got to do 2 beautiful trails and spent a few nights in a little cabin, and it was really relaxing and a lovely little vacation.
Mm-hmm.
There was some beautiful fall foliage, and my butt still hurts from the very long hike. That was we got to plan it in advance with our 2 vehicles, so that we did the whole thing in a mostly downhill direction.
Oh, okay.
But that uses different muscles, and they hurt now.
It was my first time in Riding Mountain, too, and it's very pretty.
Oh,
and the
nice.
little town of...
Wasagaming?
Near
That's it.
Wasagaming, yeah.
Yeah.
was quite pretty.
Yeah.
We had a friend with us who was a friendly local guide, and because he spent a lot of his childhood summers up in Riding Mountains, so...
Nice. Lovely.
So he wandered us around. That was lovely.
Very cute. I love Riding Mountain. We went there twice this year. And it's a lovely spot. It's beautiful. There's lots to do, and that's lovely.
And the weather is weirdly nice.
It's September 30th and it's 30 degrees outside.
Yeah, it is quite nice. I was looking at my garden today. It's like I still have stuff in there. It's like I guess I do have to take that out at some point. But
that's our next week too.
But I'm like, no frost yet. Knock on wood.
I have so many tomatoes, Laura.
Oh man, I did okay. I didn't do that well for tomatoes, but
want some?
Maybe we'll see. I don't have any time to process anything though. So
early frost took out all our cucumbers though.
No.
Yeah, so sad.
Boo.
I have at least 30 bags of unprocessed tomatoes in my freezer and more that still have to. So we're going to be making some tomato paste.
Lovely.
If you would like some tomato paste, we can bring some around. We probably don't have enough room in our freezers. But yeah, our garden, and I also started piano lessons again. For the first time this week.
Super fun.
After talking about it for 15 years.
Good for you.
So did Huxley.
Yay.
That's awesome.
Yeah, because I taught myself when I was a kid, and then I took lessons when I was a teenager. And then I didn't play during my 20s. And then I got a piano as soon as I got divorced. And then it's just kind of been plonking around on it for the last 15 years. And I finally found somebody who seemed like they would be a good fit. So we're going to try it out, see if I can just work on a couple of problems that I've noticed, and go from there.
Nice.
Wonderful.
Well, good luck with that.
Thank you.
Wonderful.
Anybody else?
My something nice is, the weather's been nice that I can keep riding my bike to work and school and that right now. And that's nice. It's nice to be able to do that. And
how's school going?
I don't want to talk about it.
Okay, then we won't talk about that.
My something nice is I have, for the last 2 weeks, I've been working at the Trans Health Clinic here in Winnipeg, doing gender-affirming care, primarily focused on provision of hormone therapy for folks, and it has been totally wonderful. Some of the most positive patient interactions, some of the most rewarding work that I've done. And I'm loving the work, and I'm loving the fact that it will prepare me to be a better trans-affirming provider once I'm done residency in 9 months or so.
Whoop, whoop. We need somebody like you to stay in town.
I'm not planning to go anywhere.
I know, I'm just saying that, speaking as a member of the unmedicated trans community, we need somebody who understands.
I will make mistakes, but I will continue to do my best every day.
It's all anyone asks of you, Jem.
Gotta be better than Dr. AI.
First name, generative.
Dr. Generative AI.
Large language model MD.
Amazing.
LLMD, yeah.
All right.
And with that,
we brought it back down again, Jem. Success.
Well, thanks for joining me tonight, everybody.
Thanks, folks.
Thank you.
Andrew Wakefield is human garbage.
Good night.
All his friends.
All right. Good night.
Good night.
Show notes and references for all of our episodes are available at lueepodcast.com, where you can also find links to donate or get in touch. If you'd like to support the show, the best way to do that is with a review on Apple Podcasts, or wherever else you found us, or by sharing this episode with a friend.